Hello, my name's Lacey Herring, and I chose to do a project on teaching parents about diaper dermatitis. The reason that I chose to do this project is because I feel like parents, upon discharge, could use a little bit more education on the prevention and treatment of diaper dermatitis or diaper rash. When talking to my preceptor, I learned that in our unit, for the last 2 years, years 2013 and 2014, every quarter we had about 2 patients per 60 patients who showed signs of diaper dermatitis. As to be in the hospital, I consider that a pretty good number that only 2 had it. So I feel like as nurses we should pass along the education that we're giving to the parents in order for them to prevent it once they're discharged and to know what to do if they were to encounter it at home. I also believe, after working in the unit around babies for the past 7 years, that diaper dermatitis is preventable for most cases. I mean, some are going to be prone to get it regardless, but for the most cases it is preventable, and once babies have it, it can be quite miserable for them, cause them lots of pain, lots of crying, and that can be hard on parents once they're home because, waking up in the middle of the night and a simple diaper change turns into a screaming battle for the next 30 minutes can be hard on parents. So if they have these tools in place, once they go home, then hopefully they can avoid a fussy baby from diaper dermatitis. Anyway, the way I did my project was I met with 8 different families and discussed my teaching brochure that I made on diaper dermatitis with them. I asked them, first I did a pretest, and I asked them basically their knowledge on the subject, if they knew the causes, if they knew the signs of diaper dermatitis, if they knew how to treat it once there were signs, and how to prevent. Most of the parents didn't know the answers. A few of them had good answers, but most of them obviously needed more education. So I went over my brochure with the parents, and I taught them the causes, what to look for. I showed them pictures. Then I showed them how to treat it, and then I went into length about how to prevent it. So to test their knowledge base, once I went over it, I went back over the same questions, the causes, the treatments, the signs, and prevention, and they all seemed to have a good understanding of the answers, what we had discussed. They verbalized good understanding. So then later on that week, I went by each bedside and met with the families and to see if they had went and started to take preventative measures, if they were cleaning their baby's bottom well, letting it dry completely, and applying a barrier such as Decidin, Sensicare, or Boudreaux's bud paste, and also making sure that they were changing the diapers every 3 to 4 hours to prevent urine and feces just sitting on their bottom too long. And all parents were 100% compliant both times I've checked on them. And so this to me is a sign that once they go home, they will know how to prevent, which is good. And then they also have the tools that they need to recognize the signs of diaper dermatitis and how to treat it once they see it. And then they'll also have knowledge of when they need to see their physician. I think this was good for them, and I enjoyed getting to help parents ease into the transition of being at home. Thank you.